Good afternoon. I know if you well enough, when you say 5 minutes, you really means 5 minutes. And given those great speeches, I decided to put my official speech away and make some remarks, mostly to actually challenge the expert we're going to have later on, and particularly the fact that we're being asked to provide some solutions as opposed to actually rehearsing the problems that we all know. I want to make 3 points. Number one, just reflect on the lessons learned from the COVID-19. And then second, suggest a couple of concrete solutions that we could actually think together so we can be part of the solution, as we say at the African Union, African solution to African problems. And last but not least, I want to put one big ideas on the table, particularly with regard to our relations with BRICS, which I hope will be the takeaway from the conversation. On the lessons learned, let me start with the most obvious one. When we talk about the most vulnerable, one of the things we tend to forget is gender in particular. Women happen to be actually the most vulnerable. So whatever solution that we have going forward is extremely critical that we make sure we have gender sensitive actually solutions, as opposed to just talking about the most vulnerable, knowing that gender in particular happen to be a concern for all of us. I think second lesson that we learned from COVID-19 is the power of data, an early warning system and diagnostic and actually risk profiling. I am a strong believer for our policymakers to make informed decisions. They do need to have access to reliable data, but more importantly, they need to actually understand the risk we're exposed to as a nation, as opposed to making general decisions without the data. I think third, for some of us who follow the health sector in Africa, have realized most of our countries were caught by surprise and not have a contingency planning, a preparedness that allows them to deal with the pandemic and epidemic sort of going forward. It is extremely critical. Of the lessons of COVID-19, we have to develop our investment in our health sector so we can be better prepared. Last but not least, we've also seen as a lesson the lack of coordination within our governments led to not having the appropriate response in most of our countries. So indeed, it is necessary going forward in most of our countries, we actually strengthen our coordination capabilities so we can actually respond adequately. So the question becomes, learning from this lesson, what are some of the solutions we have to think together collectively? I think number one, we need to improve our risk profiling as well as understanding our exposure to actually pandemic. If you look at Africa as a whole, 50% of our exposure to pandemics are predictable. We can anticipate. And that sense of anticipation allows us as a continent to come up with the mitigations so we can save life and livelihood. And that is why I'm extremely delighted with the Africa CDC. We've decided to join forces so we can start actually map out the risk exposure of African countries when it comes to outbreak and epidemic. I think second part of the solution, how do we actually help our member states, African countries, to beef up our contingency planning mechanisms so that going forward within government, when a disaster or epidemic happened, we actually don't struggle as African government to actually respond. And that is why, again, with the African CDC, we are delighted to actually join forces so we can actually be able to provide the capacity building necessary for African government to be prepared to outbreak an epidemic going forward. I think the third part of the solution is innovative financing. We've seen all over Africa when COVID struck, given the challenges within our national budget, most governments actually struggle to find resources to actually respond. Luckily, there's some innovation that we can do in financing. In our particular case, at the African Risk Capacity, we have been working for the past 4 years to leverage the insurance market to provide actually funding whereby the first response of our governments is actually provided to the insurance market. And that's why I'm delighted to have the Gate Foundation here, with whom we work with to make sure that our response to the insurance market is gender sensitive. So what it does, basically, it allows actually our countries when there is a disaster, particularly related to outbreak and epidemic, your first response is actually fully funded to the insurance market. But we know that the insurance market is not the only solution. That's why we're delighted with the CDC to make sure we can actually develop other innovative financing mechanisms. In this case, contingency funding, so that will complement the insurance market so we can respond. Last two solutions we need to think about, we've seen the power of the private sector during COVID-19. And I think our governments should actually promote public and private partnership, whereby local manufacturing is strengthened across Africa so that the private sector can be part of the solutions. Last but not least, we haven't talked about, there's an elephant in the room, and that is the world is about to host COP28 in Dubai. There's a huge impact of climate change in the healthcare sector. So therefore, our solutions need to be holistic, not just focus on the healthcare sector, but also looking at climate change. My big idea is the following. I believe within BRICS and the African countries, we can come together, come up with a very ambitious climate and health preparedness and response for Africa, so that no one is left behind. And I hope our expert at the end of the conversation will tell us how do we move that big idea forward, so that going forward, no one is left behind. So on that note, Fifi, thank you very much, and over to you.